Hey YouTube, this is Dr. Ray and Dr. T. We are back again. Today we are going to talk about racism in nursing. So we want to discuss from a BIPOC lens some of the challenges with racism in the nursing profession. So starting off, Dr. Pace is going to talk about how racism has been embedded in the nursing profession since the very beginning.
All right, so if you watched the video from last week, you will know we talked about, like, say, 3 reasons as to why minorities have a hard time getting into nursing programs. Well, this is kind of an extension on that, and we're kind of recapping a little bit, but then we're going to extend on this topic in terms of racism in nursing in general. So I'm going to start with your girl Florence that y'all love to hate, that I love to hate. Florence Nightingale is considered to be the mother of modern day nursing. And because she was considered to be the hallmark of why we do what we do today, because she had supposedly come up with infection infection protocols, sanitation protocols, the charting systems, documentation of sorts. She got credited with that when in all actuality, Mary Seacole is she's a Jamaican nurse who wanted to work alongside with Florence, but Florence said no. And she basically took her ideas and ran with it. And so therefore she gets credited with it as the same with every other inventor who happens to steal things from minority inventors. So Florence, she did not want minorities in nursing, and she was also a sexist in that she did not want men in nursing. She believed that nursing was supposed to be a profession of someone who is nurturing, caring. And that's the one thing I actually can say I agree with Florence on. It is more so a profession of that. She thought we should be submissive unto men, therefore under positions. That's kind of how that whole narrative came to be as well, where supposedly there's a hierarchy of physician here, nurse here, excuse me, because of what she thought. And that men were considered to be the strength. So we were to use them, and we typically still do. When we come and say, hey, can you help my patient up? Can you reach that for me? Can you do this? Can you do that? That's what she meant by that. And we still kind of follow on those narratives even today. As a result of that, we still have, even today, roughly about 76-78% Caucasian nurses in the workforce today, depending on the data that you look at. We also have only about 12%, let's say it's about 10% of nurses, we're talking about all nurses, LPNs, RNs, all the above. They're roughly about 10%. And to put it in perspective, the nursing population of nurses should reflect the general population who we serve. So if the nursing population is 76% Caucasian, it actually matches or mirrors the US population of Caucasian residents in terms of what, 78% or ish, okay, ish. I could be off a little bit, depends on which data you look at. When it comes to the next demographic underneath Caucasian is Hispanic. They actually represent 18% of the US population. They actually passed African Americans now. It used to be us and then them. Now they're 18%, but in nursing, they only represent like close to 4% of nurses. Again, that's disproportionate. Let's go down to blacks, okay? African Americans, blacks, we represent roughly about 12% to 13% of the US population, but only less than 10% of nurses. And then of course it trickles down when you get into your islanders and biracial and things like that, however it breaks down. So if you think about proportion and how you talk about favorable outcomes for your patients, which this is what Dr. Ray's going to kind of tie into later on, having favorable outcomes, you understand from the very beginning the importance of having ethnic minorities in nursing, because our patients are being taken care of by the majority, Caucasian people who do not understand our culture, our ways of being, just who we are. And that's just how it is. So Florence was the catalyst for all of this to go on. And so therefore, who do we teach about in nursing school? Florence. Who do you think teaches our students? Florence followers. Because also in nursing school, your faculty are majority, I don't have the statistics, but majority Caucasian. So if you have people who are nursing, who are Florence followers, who are majority Caucasian, who follows her narrative of what nursing should be and should not be, of course, then you understand why we have issues getting into the program. So let's talk about the selection process. A lot of nursing schools have admission criteria in which you have prereqs you have to do, certain GPAs, certain entrance exams, interviews, and so forth. There is a myriad of ways in which they determine who they allow in programs based on how many seats they have and so forth. As an example, our program allows 36 students in per semester. I worked for a school that allowed 60-something students in per semester. And how do we pick those students? Well, you have what's called an admission committee. That admission committee decides based off of some criteria, point system or whatever, how they select people. Now, one thing I want you to be mindful of, if people are these Florence Nightingale followers, okay, as I call them, they may pick people based off of certain criteria that they want them to look like. So when I'm looking at applications, if I'm on the admission committee and I'm looking at applications, I may see someone's name and I say, okay, you know what? They have an ethnic name. Let me even go to social media and verify and see who they are. You know what? I'm going to slide the application to the side because I saw them and I wasn't really impressed with what I saw. Now, you haven't checked to see if they meet the GPA prerequisite, T-score requirements or whatever point system you use. You've already made the decision based on what they look like, ethnic name, or whatever. So that's the selection process, depending on, who, what, when, where, how they get in. Keep in mind also, let's just say as a token, because nowadays we have diversity, inclusion, and equity, which seems to be a trend going around, that you know what, I want to be a part of this trend. We get more grant money or whatever it happens to be to say we are inclusive, we are diverse, and we are equitable, and on and on and on. And look, here's our 2 students who happen to look like, and put them in the forefront, and they're the picture of the pamphlet, or they are on the commercial, whatever it happens to be. So if you get in the program, then what do you go through in terms of racism in nursing? So that's when we have the gatekeeping, and that can happen to anyone, but gatekeeping tends to happen to ethnic minorities a lot, where they don't get the privilege of having certain information that other ones have. We have the unfair treatment, and I've seen this in my TikToks and people complaining that, oh, well, the white student, nursing student, they come in late, nothing happens to them. But the Black student comes in late, they're written up unsatisfactory out the program when it happens to them. So we even have unfair treatment between the 2 groups. We have where they're giving the white students privied information about test material and what's on it and this, that, and the other, and they're passing. They're even selling tests, or the instructors are helping the students learn, not even learn, I take that back, learn, no. They're helping the students cheat, get through a program, and minority students don't have privy to that. They have set up study sessions for the white students that are private, that the Black students know nothing about. So even when you get into the program, you are faced with microaggressions where they're either, oh, we can't pronounce your last name. Can we call you this? Can we call you that? No, you can call me what my name is. Or you're dealing with the other microaggressions and saying, using like honey and sweetie. We're not talking about things where you're from the South, and the South will use those as what do we use those as? Not that, what is it called? What's the word I'm looking for? Terms of endearment. Terms of endearment. We use those words as terms of endearment in the South. It's very common here. Everybody is sweetheart and on and on and on. But you can know in context that they're using that to your advantage or to your detriment. So you have, by design or by default, why are we not progressing? We simply have other issues within ourselves in terms of why we don't finish the program that our counterparts don't have. And those are some of the barriers that we have when it comes to alongside a line of racism and, having issues at home, no support system, things like that. So we're not getting support from our educators. We're not getting support from our family situation. We're not getting support from our friends. We find that we're in this all alone. We don't have the money, the things that we need. Oh, and by the way, we need a new book. Oh, I need another stethoscope. I got the wrong shoes. I need the white shoes. No writing on them, no nothing. I can't afford that. Or when I go buy the ones from Walmart, they tear up on me within the first or second clinical day. I'm having car troubles. So that's not per se racism, but that's how racism plays, rears its ugly head when we have the have and have nots, and we have the systemic reasons as to why we don't move forward in the nursing education sector. And now that I've described the setup for all this, Dr. Ray is going to talk about, now that we have made it through nursing school, we passed the boards. Now, how does racism rear its ugly head in the workforce?
Yeah, so even after going through all of that, with racism in nursing. When you get out, it continues. So unfortunately, based on the racism that has been throughout America, there is no surprise that there would be racism in nursing, particularly since it is a field dominated by Caucasians. So as a minority entering that space, unless you're working somewhere where you're just working with minorities, you will experience racism. Now, working with just minorities, that's another video. But when you are working in a population that is either diverse and mixed, or that may be predominantly white, you can expect to experience racism in nursing. That may look like microaggressions. That may look like I've even seen people do things as egregious as to falsify or change some of your documentation. Yes, yes. And I have also seen where people do things to directly affect your patient to make you look like you're not a competent nurse. Like one example, when I used to work in the ICU, the tech, who was also Caucasian, would delay helping the ethnic minority nurses, or if they would ever have time to help us at all. Oftentimes, we would have to do total care for our patients alone because they would be busy with the other nurses. So it could look like a lot of different things. It could look like, as Dr. Pace mentioned earlier, you having harsher consequences for things that your Caucasian counterparts would not have. You also will find yourself misunderstood a lot. So with ethnic minorities, we tend to be very expressive with our emotions, regardless of the emotion. So that's just kind of the culture. So like if we're happy, we might be really happy, which our voice may escalate. If we're upset, our voice may escalate, it may deepen. These are just some of the expressions that we have. It doesn't mean that we're a threat or that we're a bad person. That's just how it is. So that may be misinterpreted as being aggressive. If you speak up oftentimes for mistreatment, you may be looked at as aggressive. I always tell people to have a witness, have more than one if possible, and record if you can. And which is ridiculous that you have to go through all of that, but that's how it is in a lot of settings. Additionally, you will be called, your knowledge will be called to question. So you can say the exact same thing as your counterpart and do the exact same thing, but for some reason, when you do it or when you say it, it's looked at as inaccurate or it's called to question. And that's in various roles, because I'm also an advanced practice nurse, so we get that all the time. So, you may be delivering patient education or doing an intervention where you have to explain something, and your patient may think that the information isn't quality information or perhaps isn't correct information because they have a bias against you. And someone else could come behind you who is of another race and say the exact same thing. In fact, you taught that person how to do it. But somehow when they do it, it is deemed to be more valuable. So these are just a few examples. I mean, we could go on forever, but the video would be too long of how it shows up in nursing. So you may get it from the patients as well as the other nurses. And I always say, this is just my personal opinion. First of all, I want to start by saying racism, discrimination is always discussed and doesn't matter who it's coming from. But in my opinion, it is worse when it's from the staff because patients will come and go. Unless you're somewhere in a long-term facility where the patients kind of hang around, most of the time patients will come and patients will go for whatever reason. But the staff tend to be the people that you have to deal with day in and day out. So when you have to deal with them and their biases and their racism, to me, it's even worse because it's day in and day out, and it contributes to our burnout and our disdain for the profession. So if you can imagine dealing with that on top of working in healthcare, which anything you do when you work with the public is a hard job. I don't care what it is. So you're already doing something hard, it's something challenging, something where we're often challenged with staffing issues, et cetera. And on top of all of that burden, you also have racism and being discriminated against. So these are just a few of the ways that racism shows up in nursing once you get into practice. And don't even think about if you run to advanced practice, it's going to be any different. I promise you it's worse because then you're also dealing with the racist physicians.
Mm.
going to also challenge you and undermine you, in addition to the nurses, because nursing bullying, it doesn't stop. So um, those are a few ways that it shows up once you're actually in practice.
I want to kind of piggyback just a little bit before I close out and talk about how you just mentioned what even in advanced practice, as you know, as a nurse practitioner, it doesn't change. The thing is, even for us as minorities, even when we get to the highest level of education, which is a doctoral level, doctorate in nursing, in this case, it could be a doctorate in anything really, but the same thing is going to be felt. That we as ethnic minorities feel like we have to fight tooth and nail to preserve our name, our title, our credentials even are more so like come under charge, or who did you buy that degree from? Just because you didn't work hard for yours don't mean we didn't work hard for ours. And so it's when they say it's lonely at the top, we know what that means. We know exactly what that means, because there's not a lot of us who have the higher level of education, and we still get the same brunt of issues from physicians. Even it's okay, well, you're not a physician. Didn't want to be. I could have been if I wanted to be. So then they have their own insecurities, because see, I can. And that's something too that plays itself out, that rears its ugly head, is people have insecurities and then they project those onto us. So then they say you are X, Y, and Z because, and it's like, okay, well, if I was white, would you attack me this way? Would you even care? No, a lot of times they don't. They're insecure within themselves. So it's lonely at the top. It don't get any better because the higher education you get. So don't ever think that you get more education that is going to be, no. If anything, you are going to be. Think about a white shirt with some dark lint on it. That's us.
Mhm.
A white shirt with dark lint, a piece of lint here, a piece of, you have your shirts will beat up, piece of
Mhm.
lint on it or whatever. Imagine one of them being one person amongst that whole sea of white. That's what we look like when we go to the top. And we feel
Mhm.
isolated up there. We don't have anybody around. When we find somebody, we try to cling on to them, because why? We need support. We need someone to be a sound box to say, okay, I'm having these issues today, type of thing. So, okay, that wraps up our video today on racism in nursing and just our take on it and where it stems from and where it is, why it is. But we want you to go back and watch the last video. The last video talked about barriers as to why, 3 barriers as to why you can't get into nursing school, used to being Black. And then this kind of piggybacks off of that. Also, if you do not mind, please follow us on our other social media platforms, which is TikTok and Instagram. And the handle is at Nursing Dynamics for both of them, Nursing Dynamics. Also, many have asked, what can we do? Where can I find a book? What do you recommend for this, that, and the other when it comes to nursing school? NCLEX prep, med surg, anatomy physiology, you name it, pharmacology. We have, if you go to our banner at the top, you will see the Amazon icon. If you click on the icon, it will take you to our storefront. In our storefront, you will see different categories, but the one I'm speaking of today is nursing essentials, in which you will find the things that we have vetted already to be vetted to say that these are good quality products that will help you in your nursing journey. So that is it for today. Thank you so much for watching this video and the others. Please watch the other videos as well. Comment, please, subscribe, and share. And until the next time, you all take care. Bye-bye.
Bye.